food-producing country. And this is due to the National Food Security Act, which is enacted in 2013. We also, at the moment, facing many challenges, including impact of climate change, land degradation, with excessive use of fertilizer, and that create biodiversity loss, unsustainable groundwater. Farmers also reduce the farm size, and they are looking for other livelihood alternatives. Food safety concern as well on the contamination of food. And the government intervention has trying to double the income of farmers by 2022 and to provide water through the irrigated system. The presentation today will be something to deep dive into the nutrition security. And I'd like to hear from the speaker in connection to this baseline information about India food security. So now I'd like to get back to the Ms. Janet for invitation of the speaker. Thank you.
Thank you so much, sir. So our today's webinar topic is empirical and qualitative study of nutrition security in India. I would like to speak about our honorable speaker, Dr. Ruchira Bhattacharya. She is assistant professor and head in charge, National Institute of Rural Development and Panchayati Raj, Delhi branch, New Delhi, India. And she is also professor at the Center for CSR PPPPA and research consultant. She did her PhD from JNU, which is Jawaharlal Nehru University, New Delhi, on the changes in the public distribution system in India, and jointly held a researcher position in Center for Social Science and Humanities, Delhi, for a longitudinal village study of the London School of Economics. Prior to joining NIRD-PR, she has taught development economics at the Ambedkar University, Delhi, worked as a program officer in Population Council. So to know more about her research interest and her publication, you can click on this our expert database link. So before there are few points I would like to draw your attention. Please, during the presentation, please mute your microphone. We will have question and answer session after the presentation. You can ask your questions or suggestion or opinion directly to the speaker. You can stay updated through our LinkedIn, our Facebook, Twitter page, and also through our website. Thank you so much. Now, I would like to welcome Dr. Ruchira Bhattacharya to start her presentation. Ma'am.
Thank you so much, Ren. Thank you so much for the invitation, and it's so nice to come back because I think I had presented something last year as well. So thank you for inviting me again. I would like to share my screen, and please let me know if you can see the PowerPoint once I share it.
Okay, ma'am. Yes, we can see the PowerPoint.
Is the slideshow visible?
Yes, visible, ma'am.
Okay, great. Thank you so much. So good morning, everyone. And we would be talking about nutrition security in India from some of the quantitative evidence that we have and some qualitative evidence that is already there. And thank you so much, Dr. Chirstag Birapat, for introducing the topic of the webinar and setting the agenda. You are absolutely right in saying that India has done a great job in creating a pool of food surplus from a situation of food deficit. So back in 1947, when we were just starting, we were in an absolute food deficit condition. We were forced to take grains from other countries. There was PL 480 that was being donated to us by United States, and the situation was horrible. And then from there, through Green Revolution, through different kind of innovations and different policies and programs, we have come to a situation where food security is no longer a concern as so much, because we are a food surplus country and net exporters of some of the grains. But still there are realities in terms of nutritional outcome, in terms of hunger in India, which calls to ask the question that what really went wrong. Because even now, if we see the data, any kind of evidence, be it a sample evidence of NSSO, which is the only evidence on consumer expenditure survey, or the food utilization surveys that come from DHS cities or the IHDS surveys, in all the surveys, there is one reality which is very clear, that India has a hunger problem. So we have a complex history of food security. We still scored 111 out of 125 countries in terms of the Global Hunger Index. There have been questions regarding the construction of the index because it overwhelmingly takes indicators which are of food absorption, utilization, and not so much of production, accessibility, etc. But still the performance is really, really worrying if you look at the ranking in terms of the size of the country, the stability that we have had otherwise, and the fact that we are in fact a surplus country in terms of food grains. Our overall average calorie and protein intake that we can see from the NSSO data sets, we see that the average caloric and protein intake in the country has been declining. Up until 2011, at least, the data that 2022 has just come out, we are yet to see what is happening. But the only macronutrient that shows an increase is the fat intake in the people. We have a low dietary diversity and a high chronic energy deficiency. So about 1 in 5 adult women or men are chronically energy deficient. Their body mass index is not what it should be for their age. And we also have a double burden or triple burden of malnutrition, because we also have the current trend also shows that our obesity rates are also going up. But there is also mixed performance on the other pillars of food security in India. So our food availability conditions have seen improvement with surplus production, increased distribution. Food access conditions in rural areas have seen some challenges. We see that there have been sharp increases in real food prices, and there are shocks to it at some point of time. Some period will be very stable, but then there are shocks, and then we see that real food prices go up. There is low security against food price inflation due to the absence of a risk market making credit or insurance available. So there is an unavailability of any kind of insurance against any food shocks in the market. There is a shift away from food productions through continuous diversification towards non-farm occupations. I think this is what Dr. Virapat also mentions in the beginning, but because our farm is becoming increasingly smaller in size, and that has an impact on what kind of cropping is being produced, the yield rate, the choice of technology that is being used, everything. And we see that there is a non-farm diversification. People are leaving agriculture basically. We see increasing commoditization of agriculture because people are taking up crops which are extremely well taken or well sold in the markets. Not so much of a concern for nutrition. Increasing landlessness, which again have an impact on people leaving agriculture, going out and working somewhere else. Also, there are recent disruptions such as the lockdown post-COVID-19, which has a long-term impact on our livelihood, our economy, and our food security conditions. And this resonates with the global worsening of food security since the COVID-19 pandemic and continuous economic crisis. Now, some of the recent studies of the food on food and nutrition security that we see, they also highlight a few things which we can all agree about. I have not taken all the things that are given in the study because some of the things, they don't come from the recent data sets, but whatever comes from the recent data and we can all agree, I have just noted it down. This is an open access book, you can all read it. But I think some of the points that they rightly mentioned are that policy interventions, we must distinguish between supply side constraints to food availability and demand side factors that affect household access and utilization. Then there is a reason why nutrition and food security should be studied from the lens of intersectionality, because there is huge vertical and horizontal differences in the way population can access food or even get avail proper nutrition. We have evidence that empowerment of women have a direct link with nutrition security of the households. However, results may vary with how women's empowerment are measured and understood. There are spatial and societal inequalities, regions that are food insecurity hotspots. There are also vertical inequalities. So there are marginalized populations such as migrant workers and urban poor, who are often left out of any kind of social protection system around food, and they are not covered by the programs around food security. We see there is overall increase in investment on making health nutrition accessible, and that is more effective than focusing only on distributive policies. So the point is, if the overall investment is low, then there is lesser impact of distributive policies. So overall investment needs to increase for distributive policies to work. And other than programs, family support and access to insurance emerge as essential for individual state of well-being and access to health and nutrition. So these are some of the contexts that we have. Now, in India, food security concerns manifest in many ways, and I have divided it into the 4 pillars that we all understand around food nutrition security for the sake of structuring the discussion. In terms of availability, we know that there is nutrition imbalanced food systems. We have taken the path of creating a food surplus country. And by that, we have created a country which has surplus of 2 kinds of grains, either rice or wheat. We have not really thought about nutrition sensitive crops or nutrition rich crops at the time. That was a requirement of the time, I understand. But right now, we see the impact that our food systems do not cater to the micronutrient needs of the population. We also treat agriculture as a livelihood for the large majority, the 70% that Dr. Veerapat mentioned in the beginning. Agriculture is treated as a livelihood option. So it is not treated as a source of food yet in the population, which means that any option that comes to increase the income from agriculture or any option that will make lives better for these households other than agriculture, people will take the other option. So developing agriculture as a source of sustained food and nutrition, that is not the concern in the population right now. Also, there is impending threats from climate change, soil quality decline, and water crisis that right now we have started seeing the initial impact of it. But I think 10 years down the line, it will be an extremely huge threat to our population. And at the time, we will be talking about it much more because this is something that it seems like it's not reversible at the point. There are also concerns on access. So we have 233.9 million people classified as undernourished and the largest contributor of undernourishment in South Asia, simply by the population share. High prevalence of severe food insecurity, around 24% of our population are severely food insecure. We have indication of poor distribution during COVID. So although we have a very strong and very large social protection around provision of food and nutrition, but at the time of shocks like COVID or lockdown, etc., we have seen that the distribution has been poor. So the gap in the issue of new ration cards have been observed to new members of eligible households. We see that a demand for programs like public distribution system. So the PDS means public distribution system, which is the largest social protection scheme in India to provide food grains to the households. That has gone up during the post-COVID period. So offtake has increased, which also kind of indicates, although it's a good news that offtake has increased for the program, but it indicates that the population still requires this kind of a program to protect them from food insecurity. There are concerns of utilization, which reflects in the global hunger index ranking, but we see that situation is that 1 in 3 of India's under 5 children are underweight. More than 1 in 3 are stunted, which is low height for age. About 1 in 5 are wasted, low weight for height, etc. And there are stability concerns. We have had high food inflation of 6.2% in the fiscal years of 2020 to 2023. And peak inflation was seen last year in July 2023. We also have poor Anganwadi and school meal performance and high offtake of PDS staple during the lockdown, reporting inadequate dietary intake. The combined effect of all these realities is something like this. This is an inflation figure. You should see that in 2018-19, we are doing comparatively well. Our food inflation was quite low. But the moment COVID comes to 2020, 2021, it shot up and it has been high ever since. And we also have these kinds of newses that our lockdown diet is boiled rice and salt. There are households at the margin who could not acquire proper nutritious food. There are concerns around hunger, around nutrition, despite the fact that we are a food surplus country. So there are some imperfections in the system that we need to really understand, that we need to talk about to really make a proper impact. So today we will be talking about the interlinked story about nutrition availability and access in rural India, because we are saying that there is a link between what we produce and what we eat. And I will be limiting my discussion to macronutrient consumption in this part and the covariates. We will be talking about calorie, protein, and fat, not going to macronutrients. Simply because there is not enough data around that. So there are concerns on shifting focus from barriers to food access and equity, that is demand side barriers, to technical solutions such as creating nutrition sensitive agroecological systems or changing production patterns, so supply side barriers. Now, before delving into the merits of these concerns, that we are only talking about agrocentric or technocentric solutions to something, there are other issues, etc. So we'll look at the data and what is happening. But we need to understand the changes in the food security conditions at first. What has really happened in the composition of India's household, what they're eating, how it has changed, and how it relates to what we produce. So basically, we need to start from the beginning, that are we really eating what we are producing, or there is something else that is happening in the ground? And this will need a retrospective approach. We will see the data from a little back, and we'll see how the composition of diet has changed. So in this presentation, we will discuss the production, consumption, and social protection using existing qualitative and quantitative evidences. We will also limit the discussion to the nutrition sources to macronutrient, as I already told you. We will show the evidence of changing source and composition of Indian household level consumption using the NSSO data. This is the only large scale data in India we have that really reports the exact consumption by items. We don't have any more data. 2020 and 22 data is already out in terms of fact sheet. We don't have the unit data, so we cannot add it at this point. And we will also show that there is a structural shift in India's food access conditions, and the shift is visible for both composition of diet as well as source of food. We will explore the intersection of the structural shift with other social and demographic indicators. Now, this is a figure that I had shown you last year when I came here, and it still is very much important and very relevant, although the data is a little dated, but the reality is still the same. So we see that globally, 795 million people, that is 1 in 9 people, are undernourished. And out of this 795 million people, overwhelmingly large number is only residing in South Asia. If we see the India condition, we have 3 in 10 stunted children. This is the dated data from NFHS. 53% of women between 15 to 49 years are anemic. 80% infant young children did not get minimum dietary diversity in India at that year. And this reality coexists with this reality that over 50% of total workforce is employed in the agricultural sector. So we are producing food, but we are not consuming it for some reason. Agriculture is so important for us that if global food prices double, India could lose up to $49 billion in GDP. So it is an important sector for our economy. It is an important sector in terms of livelihood because most of the people work here, but still somehow we are not faring well or performing well in the nutrition utilization sector. If we look at how we import our crops, what kind of crops we are importing from outside, the trade of food grains, the reality becomes even more little more clearer. 2019 to 2021, if you see the import value in crores of rice, wheat, other cereals and pulses, you see that the only crop that has a significant dent and is going up over the time is the pulse. So our country is a highly pulse consuming country, and it is something that we don't produce. So to cater to the population's need of pulses, we have to import it over and over, which means the prices of pulses and around the legumes and the other grains, which is highly, and the population is highly dependent on it for protein, etc., the prices of it will also go up because we are importing it. And other grains such as rice, wheat, there is no need to import. We are a surplus country, we are net exporters. But other cereals, which are a little more nutrient rich, we also see that there has been an import, although there is a decline in the import. But pulses, you can see that we are definitely consuming it more and more. There is no decline in the consumption. We are not able to produce it at much, and we are importing it from other countries. Link it to the reality of prevalence of undernourishment. This is the SOFI report. And we see that although there is a decline in malnourishment, the share of South Asia in the overall malnourishment is very high. So you have the red graph over here, which is the global malnourishment data. And look at South Asia up above here. So it's very high. And look at this trend of India. So it is even higher than the average of South Asia. And in fact, India kind of mirrors the pattern in the world. We see there is a slight increase in malnourishment in 2017 to 19 period. And India shows a quite visible increase in malnourishment from 2016-18 to 2017-19. Whereas South Asia shows kind of a stability in this particular indicator. If we look at the number of persons undernourished, India has overwhelmingly large share in terms of population share in the number of persons undernourished. So 690 million or 8.9% of the world's population were undernourished in 2019, and majority of this population resides in the developing countries. And in South Asia, India takes the larger share of that. But this is a little bit of, the imperfection that I was talking about, which it's very clear when we look at how our food stocks are faring in India. So it's not that we don't have food. We have food. Our stocks are swelling up. So if you look at the kind of stocks we have starting from around 1974, coming to around 2020, we see that the food stocks have continuously increased and swelled up in terms of million tons. So if there is no dearth of food, so there has been something wrong in distributing this food to people who are needing it. We also experience high level of food insecurity. So people who have responded that they either did not get a full square meal in the last 1 week, or they did not get what they wanted to eat in the last 1 week, or they had to skip a meal. So these are some combination of questions that we combine to create the food insecurity index. And we see that in that also, South Asia's share is very high, and then within that, India has very high share. And juxtaposing this with this reality that our food stocks are pretty good at this point, this shows that there has been some imperfections in how the policies have distributed this food. Now, we also see that India percentage of people are unable to afford a healthy diet. This has only increased over the time. So it has doubled from 2017. And if you look at the minimum dietary requirement data, slowly we see that the India's percentage of population that actually take the recommended dietary intake in terms of micronutrients, that has declined on an average for many of the major vitamins. So vitamin A, we see a decline from 1975 to 2021. We see a decline in vitamin C from 1975 to 2021, and so on. So what are the structural changes in macronutrient access conditions in rural India? If we just focus on the fact that we have calorie, we have protein, we have fat, and these three things also need to be in a balance in human body. Macronutrients, of course, are a concern, but we can come to it later. But what is happening to food in terms of macronutrient access conditions, and how has it changed? So the only data we have to calculate this is the NSSO data. So that's what I will be using. So NSSO gives you itemized intake of food. So it gives you the quantity of each item that the household has accessed. The data has a little bit of continuity issue because the food items that they list, they keep changing their positions. So in one of the surveys, they will put ginger as a spice, and the next survey, they'll put ginger as a vegetable. So this kind of continuity issues are there. But we have done the adjustments, and we have created a comparable panel of NSSO data where all the items have been placed against each other for all the years. And we have managed to convert the quantities consumed by these households into their caloric and protein and fat equivalent. And they have a conversion table for that. We have used what they have published. And this calorie, protein, and fat equivalent has been averaged across the households and taken their share in the total calorie, protein, and fat conditions. So that share we have divided into two kinds of sources. One is the obtainment sources, that whether the calorie is obtained from open market by paying out-of-pocket cash, or whether the calorie is obtained from social protection scheme like the PDS, and whether the calories obtained from your own production. So if you are an agrarian household, or you have some source of an exchange of gifts, or some kind of in-kind wages, then did the calorie intake come from that? And we see a very stark situation of a structural change in India's consumption sources. Similarly, we have done the disaggregation in terms of the itemized source. So the different item groups we have created, and we have seen the changes, and we see a change in that as well. Now, if we look at the obtainment sources, that whether the calorie came from home or the PDS, that is social protection scheme, or the market, we see that very clearly from 1993 to 2011. There are other rounds of NSSO. We don't use it because there are sampling issues. There are issues with the fact that 2010 was an NSSO year, but then there was a drought in that year, so we removed that year as well. So we have taken three major years, 1983, 2004, and 2011. And we see that very clearly the share of calorie, protein, and fat from homegrown sources, that is from agrarian sources, that if you are an agrarian household, or you have a little bit of kitchen garden, or you have a little bit of land, or you work in somebody's field and you get food as a form of wage, etc., that source has gone down over the years. So from around 35% to 21% in case of fat, from 38% to 26% in case of protein, from 35% to 23% in case of calories. So there is a clear decline in the share of homegrown stock. But correspondingly, we don't see that. So in fat, we don't see that PDS is there. It's almost not visible. But PDS is providing higher amount of protein and higher amount of calorie. So we see that the decline that has happened in the homegrown stock in terms of protein and calorie, that has been taken up by the PDS as well. It has been supplanted by the PDS as well. And the share of market more or less, although has increased from 1992, but more or less remains the same over there with some fluctuations. So households that have left out of agriculture, they are being kind of protected by the social protection schemes. So on the one hand, we don't have access to the homegrown stock or the own production stock, but they are not going to open market to buy this amount. They are taking it from the social protections. We focus only on the bottom 40% who are the ones who are supposed to get a significant amount of PDS grains. Other households above the bottom 40, they are not eligible for PDS card. And we see that this trend is very clear and very openly visible. So we see there is from 1993, from the PDS, there is a clear increase in percentage that is taken from the percentage of protein taken from the PDS. We see that the same happens in 20 to 40% as well. So lowest 20%, 20 to 40%. And we see the same increase in PDS in calorie as well. But market more or less remains the same for all these 4 years. And we see there is a decline overall in the homegrown stock, a marginal decline, but in some of the categories, for example, 20 to 40% of the lowest income quintile. And we see there is a decline clearly of the homegrown stock supplanted by the PDS. If we look at the item group-wise sources, so this was the obtainment source that we talked about. But if we look at the item group-wise sources, we see that there is also a shift in from which are the items that households are having. We see that the calorie intake, if we look at the staples, they remain more or less at the same level. So 61% to 58%, or it stays the same as 59 to 59%. We see that the intake from coarse pulses and nuts in terms of protein, that has actually decreased. So on the one hand, we are importing more and more, the demand has gone up, but households actually consuming it, what they're consuming out of those grains that they're getting, the protein requirement that is being fulfilled, the protein amount is decreased over time. We see a slight increase in sugar and other materials. And this particular item, the orange line, it also includes processed food. So sugar and food from outside market. So things that we are directly buying, sugary items, sweets, etc. So we see an increase in that. And we see that there is a decrease in terms of milk intake, in terms of fat. So they are taking fat from pulses, nuts, etc., but not from milk. So this is another indication of what kind of pulses or legumes we are consuming. So which is more enriched in fat. So that has, taken the place of milk, but not enriched in protein, which should have been the case. If we intersect the obtainment sources and the itemized sources, we again see that fine staples from homegrown has declined over time, but from PDS it has increased. From coarse pulse nuts, it has declined over time. From PDS, there is no PDS in this particular class. From market, it has increased. So we just see that households are spending more and more on pulses and nuts. So they're taking it from open market. But the share of protein, as we've seen in the last slide, that they're not getting even after spending so much money. In terms of milk also, although milk comes very largely from own livestock, etc., but we see that over time, there also is a decline and households are taking more from market. Same with the case of oil, veg, and fruits. So in every category, we see that the market share has increased and share of these other non-market sources have declined over time, but not with the result that the protein intake from these have gone up. So same thing, we see that how we are producing it, it also shows the same kind of pattern. We're producing more and more of rice over the time. So area on rice has not gone up, but the yield has gone up very high. Same with the production of wheat. So area under wheat has not gone up, but the yield has gone up very high. So we have pumped in more water, more input, etc., to ensure that the yield is very high, the new kind of seeds, etc. But in terms of millet, we see that is not the case. The area more or less has gone up, but then the yield, the area has gone down over time. And the production has not gone up as high as rice and wheat production. So now there is a policy focus on millets. They are pumping it up. But up until 2001, we see that it's almost the same as the area, not unlike the rice and wheat production. In terms of protein also, this is the same story. We see there is a decline in the homegrown sources. Where PDS is available, PDS has supplanted it. Where it's not available, market has taken up. People are buying more and more from the market. In terms of fat also, we see the same thing. So irrespective of which macronutrient you pick up, we see that over time, your dependence on agriculture, on cultivation, on own grown food has gone down, and you're buying more and more from the market. Now, since we see that public distribution system or the social protection schemes are taking up so much of the lost item from the homegrown stock, the percentage is taken up by the PDS. We also kind of extend that figure. So after 2011, we don't have the NSSO data yet. So it's still to come out. But we have the program data of PDS where they publish the offtake data and the allocation data. And we look at the allocation and offtake ratio, and we see that post NFSA, the consumers of rice, so regions which are traditionally producing rice consuming regions, they have higher PDS consumption than the wheat consumers. And these are also the regions that basically are like the regions that are not like the green revolution areas where agriculture is highly mechanized, you are market oriented, selling everything out in the market. These are also the regions where agriculture is in smaller landholding size, it's mostly sedentary, households are probably eating from their home as well. But they have higher PDS consumption because the grain is what they traditionally eat. In terms of wheat consumers, we see that their dependence on PDS consumption is lower than their dependence on the rice consuming places. The tied over amount means that it's a balancing amount between pre and post NFSA entitlement of the household. Now, in the recent data, we don't have the calorie figure yet. We only have the fact sheet. And from the fact sheet, we see some trends coming up. And the most starking trend is that we see that percentage share of cereals in average monthly per capita consumption expenditure has gone down over time. So from 22% in starting in 1999-2000, we see that it has come down to only 5% of the average consumption of the households. And this is the only time in the whole period when we see that percentage of expenditure on cereals has gone down from other items in the household basket. So we see the item that has gone up really starkly is processed food, which is directly bought from market. This is also highly sugary and highly, they have trans fat, etc. We see that there is a slight decline in this spices, sugar, and salt. But this does not. So there is a difference. So salty food that is processed, it is put in this category. So you see an increase in this. And using sugar and salt as spices, we see a slight decline here. And we see that egg, fish, meat, and these things have slightly increased. And what we see is milk and milk products have declined over time. So very peculiar kind of expenditure pattern we see, but how it will translate into the caloric pattern that we have to still observe. But if cereal products have declined so much in terms of their expenditure burden, from which source these households are taking this, obtaining this also becomes an interesting question to observe. So when the data comes out, we'll be able to see it. Looking at the same food percentage over the food is okay. So this was on the overall expenditure. We just made it into only the food expenditure, and the pattern is much more starker. We see that there is a sharp decline in the share of cereals and cereal allied products from 37% to 11%. There is a sharp increase in processed food, packed foods, etc., which is also salty and sugary, etc. And we see that the item that goes down is basically this pulses and pulse products, and then the spices and sugar and salt. And rest of the items have been stable over the period. So first time in the history, we see that our processed food is kind of surpassing our staple consumption, which is very peculiar. And we need to see what is happening in terms of real caloric intake and fat intake in the population. Now, intersection of the source of consumption with household types. If we see how these sources of consumption intersect with different types of households, and we take primary livelihood as one of the indicators, social indicators. This is again NSSO data. This is monthly caloric consumption. This is not a panel data. Let me be very clear. This is different samples, but still given the homogeneity between the sample selection, we were just looking at the pattern between months to see how these households have been consuming from different kind of sources. And we limit ourselves to the fine staples because we are just looking at the relation between agrarian households and the non-agrarian households. We see that the non-agricultural labor households and agricultural labor households, their caloric consumption from fine staple, from homegrown sources and fine staple PDS is much lower. In the cultivator households, that is households who produce the crops, they have very high consumption from the homegrown sources. So if the households are producing, they're also consuming, and their calorie share from the homegrown sources is increasing. But we see in this year, that is 93-94, PDS is lower than your own production. Even if you are a non-agricultural labor, your consumption from home is higher than consumption from the PDS. One of the reason is that at this time, some of the wages were also paid in kind, and kind would be the some food grains, etc. That is possible. So this may be higher than the PDS. Moving forward to 2004-05, this is also when there was a structural shift in the PDS program. PDS in 2004-05 became focused only on the poor households. So first time the BPL line was used, and it was said that PDS will be targeted. So we are calling it TPDS at the time, and it will be targeted only to households that are below the poverty line. And we see that in this year, non-agricultural laborer, their fine staple from home and PDS, they kind of touch almost the same, but still very lower. Agricultural labor households, so compared to the last year when it was touching, we see that PDS kind of increases and from home it decreases. So this is also targeted PDS here. Probably they were targeted, and then we see that PDS has increased. Cultivator household, irrespective of the targeting, not targeting, they still had very high consumption from their own production sources. So it kind of indicates that if you have your homegrown source, if you have the option to, then you will probably not go for social protection scheme. That kind of tendency we see. Same in 2011-12, the last data that we have. We see the fine staple PDS is higher from almost all the households. The homegrown stock has declined even for non-agricultural labor or agricultural labor. And we see that is reflected in the higher consumption of the PDS. Cultivator household, although the amount of calorie they were having has come down in all the months, but from so the gap between PDS and homegrown has declined, but still they have very high consumption from their own grown sources. So it shows kind of a vertical difference in the consumption of the PDS and consumption from own agrarian sources. We try to see how the PDS subsidy kind of relates to the consumption of calorie from the different kind of sources. And we worked out the ratio of PDS prices to the market prices, which indicates the depth of subsidy. So higher the ratio, it means that subsidy is lower, and lower the ratio towards 1 approaches 1, which means subsidy is higher between PDS and market. And we see that there is a negative relation between the price ratio of PDS, that if the subsidy goes down, households lose in terms of calorie share. We also see that there is almost a positive relation between share of calorie from homegrown stock, being your own agriculture or your own production or some wages, etc. Although it's 0.02, it's very small amount, but we see there is a significant positive relationship, which is mild but still positive. And there is a clear regional spatial variation of this relationship. We see that the rain-fed rice-producing households, which is this, they lose in terms of calorie intake when PDS is taken up. So regions where rain-fed regions are also where agriculture is not very good. So regions where availability of food is not there, where food is not available through production, there the households are more dependent on food through distribution. So we do see that there is a link between how we produce what we produce and how we consume and what kind of sources we seek out. So there is, in fact, a link between production and consumption, and the structural shift that has happened in the production arena has kind of mirrored itself in the consumption arena as well. Now, there are other kinds of intersection with consumption. So one of the intersections that we see a very strong intersection, especially in terms of utilization of resource of nutrition, is gender. And there are clear evidence all across the world that gender is a hungered experience. Gender inequality is a major cause and effect of hunger and poverty. It is estimated that 60% of chronically hungry people are women and girls. So if you look at this graph, this is a WFP Gender Policy and Strategy Report graph, and we see that globally, if there are people who are not been able to source or secure even one full meal during the past, the recall period, they're called chronically hungry. So globally, we see 60% of these chronically hungry people are women and 40% are men. In South Asian countries where women do not hold land titles, only 10% of women probably hold land titles, and women don't have a lot of autonomy around agriculture. We see in these countries around 70% of chronically hungry are women, The same we see in the sub-Saharan Africa, where land titles are not so much. But in countries or groups of countries where women hold land titles, for example, Western Asia or land holding part of sub-Saharan Africa, we see that the relation kind of flips. So in terms of the relationship, we see 5% of women are chronically hungry in comparison to 95% of men. I'm sorry, is there a question? Is there a question? All right, I'll continue. So this gendered experience is also reflected in the data we see in India. The incidence of malnourishment is abysmally high in Indian women. Every second woman in reproductive age is anemic. We have seen that from NFHS 3 to 4, that is up until 2015-16, gender gap has remained stagnant, with percentage malnourished women more than malnourished men. We have had many starvation deaths reported back in the around the time of pre-COVID or COVID area, and we see that most of these deaths are linked to either abandoned women, old widows, or adolescent girls. And evidence shows that women and girls are often last and least to eat, and there are qualitative studies that kind of shows the evidence. We have seen from the data that girls are more likely to be thin and more prone to stunting. Mothers' education, income, and geography we see has a strong influence on stunting. We have seen that gender inequalities exist in India along the entire food production chain, so from farm to plate, and this inequality impedes the attainment of food and nutrition security in terms of utilization indicators. Women also have a strong influence on nutrition. So as producers of food, 33% of cultivators and about 47% of agricultural laborers are women. And agriculture is heavily leaned towards low nutrition crops and low income crops. So if we produce what we eat and then the producers are mostly women and we don't produce enough nutrition, then women also don't have access to nutrition. So there is a whole linkage of all these incidences together. As consumer of food, they also have an impact. So higher chances of hunger and malnutrition. And women also are the primary caregivers in the families. So as provider of nutrition influence on children's nutrition, they also have an impact on the utilization indicators. So low BMI of women. So we have around 20% of children that are born with low birth weight, and major predictors were mother's BMI, short stature of mother, and lack of antenatal care. We have repeated number of pregnancies having an impact on the nutritional outcomes in women and also in the children they will have in the later stage. Age at marriage and age at first pregnancy. Studies from low and middle income countries suggested that children of younger mothers are at disadvantage in terms of nutrition. There is a lack of knowledge about child care, lack of knowledge about caregiving practices, and negligence and ignorance on the part of mother and other caregivers for children that result in inadequate nutrition and bad health among children. And then there is taboos on breastfeeding practices. There are a lot of regional taboos, and overall there is a taboo around the duration of breastfeeding and giving supplementary food after 4 months that result into low weight among children. Studies examining gendered budgeting that kind of try to allocate some of the budget only for the gender responsive policies. They also find that overall public expenditure on health is already low. So gender responsive budgeting is less than effective in improving maternal child health nutrition access. So when the overall funding available is low, then distributive policies are not as effective as it should be. So we need to first increase the overall funding, and then the distributive policies will start showing an impact. So synthesizing what we observed so far, we see that there is a shift in food access conditions, lesser dependence on own production, stark in non-cultivating household. We see that consumption of calorie from PDS increased for the bottom 40% households. After the National Food Security Act was passed in 2015, we see there is an increased demand of PDS being demanded. Is there a question? Right. So increasing PDS shares show an effect on protein consumption. Households shift from homegrown to PDS grains, which are poor source of protein. We see decline of homegrown supplanted by the PDS for staple and sugar, and macro and micronutrients increase dependence on the market. We see a shifting source of food relates to household livelihood as cultivators continue to access homegrown stock while other groups don't. And basically the nutrition food security is characterized by changes in food access conditions of source and composition. There are contradictions in nutrition requirements and nutrition transfer through social protection. There are some contradictions in high experience of food insecurity and poor distribution of food stocks. So as cultivators consume steadily from non-market as compared to non-cultivators who shift towards market and wherever possible the PDS, it can be inferred that the changes in food access conditions mirror the structural change in rural economy. So the homegrown stock to market and the PDS is basically what is happening as a complementary shift to farm from farm to non-farm in the household. So whatever we are producing, we are consuming, and that's what we see in the structural change. So if that is happening, then we do need to talk about agriculture for nutrition security, because agriculture, we have established, is important for nutritional security in India. So starting from a food deficit situation, developments and innovation in agriculture brought food security to India in terms of providing affordable staple grains. So our pathway so far, starting back from 1950s, etc., at the time of Green Revolution, and bringing the HYV seeds, it was all towards becoming a food surplus country. But is the impact of lower staple food prices overcome by higher prices or deficit for non-staple or micronutrient-rich food? So on the one hand, our rice and wheat are cheap and available, but then pulses are very expensive, legumes are expensive, food that is micronutrient-rich are expensive. So can one complement the other? I mean, can we achieve nutrition security? The answer is no. We need to have both the kind of foods available and accessible to the households. So in the last few decades, a number of research has proved that developing resilient food systems using community empowerment and awareness as an instrument and changing agro practices towards conservation have a long-term impact on leveraging agriculture for nutrition. There is also a growing consensus on developing resilient farm systems by adopting crops that put lesser pressure on the environment and provide high nutrition to the consumers, such as millets. So this was on the availability and access part. We move on to the discussion of utilization. Huren, how much time do I have?
Ma'am, actually, we have allocated 30 minutes for the question answer session, but we can take time.
No, I mean, can I continue or should I? Because the next section is also quite long. You can stop it.
May I intervene? You still have 10 minutes presentation and half an hour question and answer, please.
Okay, I'll continue then. Thank you so much. Thank you so much for. So moving on to the utilization part, we will discuss the anthropometric outcomes and some of the correlates. And we will look at stunting, wasting, undernutrition, underweight, and anemia conditions. So these are some of the metrics that we are going to look at. So now we are moving to a different set of data. Earlier we were looking at NSSO data in India, and now we will be looking at the NFHS data, which is the Indian version of the DHS data that all of us have. So if you look at the malnutrition condition in children, India's performance, again, we see that there is not a lot of dent in malnutrition. From 52% of stunting starting in 91-92, we have reached a situation of 35.5% stunting in children. From 74% of anemia 98-99, we have now 67% anemia. And wasting has actually gone slightly higher from 91. It has declined from NFHS 4, but is still higher from NFHS 1 and 2. Underweight, again, we see there is a decline, a very visible decline. So from 53%, we have come down to 32%. But if we look at absolute terms, 32% is still very higher. So, 3 in 10 children is still, I would say, a high rate of underweight. Complementing these situations where people are, exhibiting a lack or deficit of nutrient in their body, we also have an increase in obesity in India. So we also have obesity going up from 2.1% to 3.4%. We did not have zero obesity in NFHS 1, 2, and 3. I'm sorry, the graph looks like that. It's just that I don't have data. So we just took it like that. The data comes from this 2015-16, and it was 2.1 then and 3.4 now. And this is, extremely concerning, because now we have a double burden of nutrition to worry about. So on the one hand, we have to provide right nutrition to people. We also have to change their feeding practices. We have to also look at their overall well-being and see why obesity is going up. Is there any kind of neurological changes, any kind of disease, what has onset, what is going on? So there are a lot of concerns when the micronutrient and utilization sector is looked at. In terms of adult malnutrition, we see and evidence of a gender gap. So thinness has reduced over time. So men and women who are chronically energy deficient or who do not cross the required amount of BMI, that is 18.5, that has declined over time. So from around 36% in 91-92, we now have 16 to 18%. In 2015-16, decline has been slightly higher for men than women, but still it's quite close when we look at the trend. Obesity has gone up, unfortunately. So we have the decline here, but then we have kind of from this box, we have sent people to this box. So we are, the thinner people have reduced, but now obese people have increased. So that is again a huge health concern. If you look at news, if you look at different kind of popular media, you see that there are so many concerns around heart attacks, etc. these days. So other kind of lifestyle diseases have set in and public health concerns have been created. And we see clearly that reflects in the obesity data. Anemia is something that we have not been able to change, although it's not much of a concern for men, only 25%, but for women, it has been a continued concern, given the fact that there are targeted policies for women to not fall into the situation of anemia. We have free iron tablets, we have supplementary nutrition, we have family counseling situations, we have so many schemes and sub-schemes within sub-schemes to target women that they don't fall into anemia. Yet we see that there is an increase from 51.8% in 91-92 to 57.2% in 2015-16. And there is a real need to look at what kind of food we are providing, what kind of, the nutrient content of the food, as well as the health practices and health seeking behavior of these families to really understand this data, that what is happening to anemia in India. If we look at the intersection of these indicators with some of the social indicators, we have taken women's primary education from, and this is one of the studies, this is not my own thing. I'll of course provide all the resources to Hurain and she'll share it with you. And we see that with stunting and women's primary, secondary and higher education level, there is a clear negative relation from secondary and higher education. So this is the relation between women's stunting of under 5 children and women's literacy in primary level. So we see that only primary education, although it creates a dent, although there is some kind of relation, but it actually means that primary education on stunting does not have any effect. In fact, we see that stunting has gone up when primary education has gone up, which means that let us interpret this as the fact that there is no impact of primary literacy on children's stunting. But as women's education increase, as they go on to secondary education or higher education, we see a clear negative correlation between stunting and education. Similarly with underweight, similarly with IMR. So be it underweight or IMR or stunting, we see that secondary and higher education of women have a clear negative relation with the stunting of women, with stunting of children. If we look at the intersection of wealth and outcomes, we see that undernutrition on wealth index, which is a marker of income, because we don't have income data, it's very difficult to take it. Wealth index is the next best thing that we have. And we see that as wealth increases, underweight, and this is spatial data actually. So we see that wealthier states are actually also reporting more underweight. But in the richest quintile, the wealthier states are reporting lesser underweight. So in the poorest quintile, the wealth of the state does not reflect on the health of the population. So if you're living in the poorest quintile of the population, you are less likely to benefit from the wealth or development of the state. But if you are at the richest quintile of the population, you will benefit from the wealth of the state. So if you are a richest quintile person living in a rich state, then you will not have underweight in your household. So we also see that there is some kind of an inequality in the population, which is reflected by this type of a relationship. So even if you are in a wealthier state, your own household being the poorest quintile means that you will have a risk of underweight in your household. The same thing we see in stunting. So poorest quintile living in richer state do not get benefit of reduced stunting. Stunting shows an increase if you are in the poorest quintile. And the richest quintile living in richer states, they see a reduction in stunting. Same in the IMR. So in fact, mortality rate also If you are a poorer household living in a richer state, you do not get the benefit. Poorer household, rich household living in rich state, you do get the benefit. So here it's positive, here it's negative. So it also shows that there is an inequality in how the state's wealth is also translating into the health of the population. This is something that is from some other data. So this was NFHS. This is the IHDS data. And this is something that we had done in our own paper, and you can read the paper. I'll share it with you for everyone to read. CED means chronically energy deprived, and no CED means not deprived. So BMI less than 18.5, BMI not above 18.5 if you are adult. And we saw that, and there are two sets of surveys. One is 2004 and 5, and other was 2011-12. The most important part of the survey is that this is the only data in nutrition which is a panel data. So it is the same set of people that are surveyed in 2004-5 and 2011-12. And we actually see how people's health has changed over time. All the other data sets that we saw earlier were pseudo panels, it's not the same sample, etc. So from a panel data set, we see that 65% of the sample with anthropometric outcome showed improvement from 2005 to 2011. That is, they shifted from a chronically energy deficient state to a non-chronically energy deficient state. But within that sample, women showed lowest of the CED mobility. So women were the biggest losers in terms of this improvement. Within the women also, there were further intersections. So we see women that belong from the Dalit category. So people who are scheduled caste, who are scheduled tribes, people who call themselves Dalit, they were the last to improve, and within them, the women were the last to improve. So Dalit women improved only 41% from CED to no CED status. And in fact, the proportion of individuals reporting a decline of health, that they were healthier in 2005, they became unhealthier in 2011-12, either due to age or impoverishment or whatever. We say that this percentage of negative progress was highest among the Dalit women, around 7%. So we see that there were intersections with gender and caste in this CED change over time. Now, moving on to the institutional changes needed for stability, and we are
Professor Bhattacharya, you have 1 minute.
Yeah, I'll close it soon. So I'll not go through the entire slide. I'll share it. You can all read it. So there are some conceptual framework created for opportunities for partnerships, and these are taken from other studies that are available on the internet as well. I'll share the studies as well. And we see that there are a huge chance of lot of partnerships. There are a number of institutions that can come together to work multilaterally on this problem that we observe. There is also a requirement of pooling resources and converging for nutrition. We have agriculture and food access security, health, water and sanitation, women empowerment, nutrition. So there are different divisions working in targeted areas, and we can all pool resources. And in fact, there are programs that are now kind of pressing too much on pooling of the resources and working together. And there are some challenges to convergence at different levels. There are at state level, there are some challenges in terms of collaborating because the priorities are different. Data sharing is different between states. Feedback mechanisms are not clear. At district level, there are challenges of narrow priority topics. So districts are very, very focused on certain areas, not looking into other areas. Blocks again have extremely heavy workload because they have to fulfill the targets, give the report. So, and there is often a lack of direction or guidelines to the blocks. Also, they work with extremely low resources. So they have to fulfill all the work with lowest of the resources. And they have poor communication at times. There is also a manpower crunch at almost all the levels. And at the last line, that is village or frontline level, we see there is a challenge of unbalanced incentives. So not all your frontline workers will have the same motivation, and they may have more incentive to do certain amount of tasks than the other amount of tasks. So there are local problems in convergence and challenges that we need to kind of deliberate in a separate meeting, probably step by step, line by line, to kind of identify the solutions and see the global best practices. I'll not go through all of it, but to kind of end it at one figure, basically we need to balance all the supply and demand sides. On supply side, agrarian policies, protection, promotion, adaptation, add resilience to it, nutrition sensitive agriculture, practice and feasibility, farmers' knowledge and skills, sustainable agro practices, crop insurance, agrotech innovations. On the demand side, we need to address the elephant in the room, because in all the nutrition discussions, the hunger discussions that we have, somehow the word poverty, inequality, impoverishment never comes up. We are talking about solutions, but why are people not able to afford a certain kind of food, certain group of people? So poverty, inequality has to be discussed. Your SDG 1 is important and the first stage to discuss before going to SDG 2. So we need to have this demand side discussion added to the table. Distribution efficacy of food grains, market imperfections, program imperfections that we just saw, intersection of women's empowerment, knowledge, attitude, practice around nutrition practices for the community, family counseling, bringing men on board, all those things we need to talk about, inclusiveness of the market and social protection, who it is, who are the people who are able to access it, who are the people not able to access, why they're not able to access, how they can be solved. And all these things will revolve around the discussion will revolve around the capacity needs, partnerships, convergence, technological needs, policies, innovation in all these pillars. And they are both equally important, supply and demand. It's not one is more important than the others. I will end my presentation here and let us have some discussion and questions. Thank you so much.
Thank you very much, Professor. I wonder whether the manager, Miss Janet, would like to handle on this Q&A, or you would like me to do it?
It would be better if you can do, sir.
Okay. First of all, I'd like to thank our honorable speaker very much, because this issue is very important. At the moment, CIRDAP is doing the Rural Development Report in 2023 on this subject. And our Director of Research, Professor Hilal Udin, is working on it. And this will be for all the member country of CIRDAP. So Indian information is available now for us. So thank you very much. Now I would like to open the floor to the attendants. Should you have any question, please, you can ask the speaker directly, please.
Dr. Shahbaz, yes, sir. Okay.
Yes, thank you very much. Let me first of all thank the Honorable DGF CIRDAP to organize such a excellent events, and also I would like to thank the Dr. Ruchira. Really very informative presentation we received today. Thank you very much. Actually, you provided all data and all description you made it, but a simple question remains for me that you talked about the 4 pillars of the food security in India. The first one, I think, is the availability. Second one, the access. The third one is the utilization. And the last one is the stability. But I think, what about the safety of the food you are talking? Because we are talking the nutrition security. You know that a little bit different definition between the food security and nutrition security. Because maybe I have the food security, but nutrition, I don't receive the well and safe food. And can you explain about why you are missing the safety in your pillar? Thank you very much.
Should we take the questions first and then?
Yes, ma'am. Can answer it. You can answer it first, ma'am. Then again, we can move on to the next question.
Yeah, no, this what I have, the question is extremely important because, of course, nutrition security have many more pillars, not just the 4 pillars that we discussed. Safety is one of the pillars. There are other concerns as well. However, I have tried to kind of limit it to the existing pillars that are given by the FAO's structure, to kind of structure it around that. And this is a very limited, synopsis of a very large kind of a study. So I have kind of cut it off at many places. Food safety, of course, is a concern, and this is not to kind of dilute that concern that food safety is not there. In fact, somewhere I think we have also talked about food safety in this presentation, or maybe it has not come in this presentation. But there are concerns around the kind of fertilizers that are being used for getting this from getting to a food deficit to a food surplus condition, the kind of fertilizers that are being used, the way the soil is being exploited, all these issues are coming up. There is also a huge concern about transmission loss around food in India. So those issues are also there and also being studied about. But this presentation is extremely short, and I have tried to kind of go in deep rather than go wide in terms of what the issues that we have talked. And it's not that we are not concerned about these issues, but in this presentation, you don't see it because we have tried to discuss a few things in a little bit more depth. I know it's not a very good answer to your question, but I hope that I am able to explain why the presentation does not touch upon these issues.
Okay, thank you. I have my question concerning policy and solution based action for the problem that you have outlined it in your presentation. For example, you mentioned about the food insecurity hotspot. You mentioned about the poor dissemination of food and nutrition security to people like women, children, migrant workers. And of course, they are the target group that marginalized people in remote communities. And this kind of thing, we do not have in the normal value chain system. I mean that when you produce food, you distribute them according to a normal value chain and trade. But these people are something like you need a kind of vulnerability assessment in particular, that where are they and who are they, so that who will be responsible for these people in particular, because nobody will be responsible for them. The food price will be expensive. They will not be able to afford this. So there must be a role of government or stakeholders, multi-stakeholder. And we are thinking about the food emergency reserve for this group of people. Perhaps India can take the lead as well, because you have so many people in the marginalized area and the high number of people who still lack of food and with insufficient food. So this kind of thing that I'd like to hear from you on your connection with the government, how this can be established or implement, because they will be missed out. Yeah. Okay. So this is a first question to ask you.
Right. So it's a very important point of, and there are discussions going on right from the beginning of designing the food security programs in India, right back in 1939, when we started our public distribution system, that how can we, make the food prices stable. So when the PDS started in India, price stability was one of the major concerns. We are not thinking so much about the distribution at the time. Poverty was not so much in our mind, but stabilizing the food prices and ensuring that we don't get into famine. See, India has seen devastating famines in the past, right? So we have had 3 to 4 famines, and each famine has had devastating result on mortality and morbidity in India, and extremely, long-term impact on our demography. So the concern initially starting 1939 was stabilize the prices and to ensure that we have enough.
I think my point is the data of where are these people and how are you going to allocate food supply to them directly. Yeah.
So when we have started developing our policies, at the same time, we have also started identifying people who will require the policies in a more intensive way. And for that, we have a multitude of data available. Of course, again, there are imperfections in the data. I'm not saying that the entire data is correct or perfect. There are a lot of imperfections, a lot of exclusion errors. But so far, we have different kind of sample and census data sets that allow us to identify the landholding sizes of the households. We have panchayat level records on household assets, that which are the households who have a good amount of assets which are not. This is how the initial BPL identification was done. We also have the SECC data, which is socioeconomic caste census, which takes many indicators on socioeconomic performance and caste performance, which also allows a post facto identification of the households. And the biggest identification measure that we have in India is this system of local governance. So we have panchayats, the blocks, the Zilla Parishads. They kind of have the main role in identifying the target households. And they have their parameters set, their numbers set, that within this particular level of capping, you have to identify. And we have a rich data right now. So there was a gap of the data until about a few years back. But with the GIS, etc., we have rich data at village level from Gram Panchayat to identify households that fall below a certain level of welfare. So there are systems in place which allow us to identify. And now there are talks of creating a one nation, one ration policy. So irrespective of the location of your work, so even if you're a migrant laborer, you will have the identity card, which will allow you to access your ration anywhere in India. So there is a talk of doing that. The implementation has started. We are testing, and it will be done soon. There are also, local institutions that are used to identify women and children in need through a system of frontline workers. We have Asha and Anganwadi. So our main strength is our very strong and very, well spread out and well institutionalized local governance system, through which we're identifying the right people. Data, if you imagine in terms of kind of something that we can readily analyze like census or NFHS or NSS, that kind of a population data till now we don't have. That is something probably, over the time that will be a concern and we'll be doing it. But identification is done through the system of local governance system.
Thank you very much. I think that maybe your next presentation in the future would be focused on this issue. Very interesting. Okay. So I'd like to open up to other questions, please.
Miss Yashika Ahuja, yes.
Ma'am, is one nation, one ration card making any impact on nutrition security in India?
It is not even implemented yet. So how can we talk about impact? It's an idea. There are testings and piloting being done. We'll see. Let it being implemented. But it is required. It's very much required because India is a country of migrant laborers. People keep moving, and many people leave out their on their entitlements because they are moving out from the base area. So this has been understood from a long time that nutrition programs, food security programs, they cannot be anchored to the location of residence. That's not how they work because people keep moving. So delinking it from the rest of residence was required. One nation, one ration is just a step ahead in that. And we still have to see the impact, whether it's making one or not.
We still have about 12 minutes. If anyone would like to ask question, please.
I have a few questions. Asking question. I have
Professor Hilal.
First question
please.
is like, sir, can I ask? Am I audible? It seems the connection is not stable.
Yes, Dr. Please.
You're audible, sir. You can ask, sir.
Okay. The one question is like, as you said, leveraging agriculture for food security, right, in India. Now, how could we do that? How could we see that? Like, if I look at food accessibility, like the structural change, you are saying there is a shift from homegrown stock to market, and that's fact, I know. And second thing is like, there's a shift for livelihood from farm to non-farm, right, activities. If this is so, this implies that farmers are switching out of agriculture. For their consumption, they think that if I have access to market, then I don't have to go grow, food on my own. That's one thing. Second thing is, since growing food is not profitable, that's why I'm switching from farm to non-farm sectors or activities. Now, if farmers switch out of agriculture because agriculture is not attractive in terms of income, and if you look at like SDG 2, how to, improve on like food security. So there was one, like doubling the income of smallholders, right? Farmers. So I'm asking you, like, is it like practical given the structure that they are switching out of agriculture? This is one question. Second question is like SDG 2. There is one is like doubling productivity from 2015 to 2030, right? Doubling productivity. So if I take yield per hectare as say kind of proxy of productivity, then in your figure from since 1950-51 till date, it has gone up by 400%, something like that. Right? It was close to 20, something like that, and now close to 100. So do you think that, SDG 2 is implementable given the picture here? Third question is, I couldn't follow your all the figures. Like if we want to compare like households with main source of income from food production, main source of income from cash crops, and main source of income from off-farm activities or non-farm, do we see any significant difference in terms of food security indicators? So these are the couple of questions I'm leaving to you. Maybe I'll come later with more questions. Thank you.
Thank you so much, Dr. Hilal. This is, you have asked a very fundamental question, and let me kind of try to take it up. Now, what you saw is extremely correct. People are shifting from farm to non-farm, and people are shifting in terms of consumption also from homegrown to market. Now, what we basically are saying is by leveraging agriculture for food security is not to bring people back to consumption from the farm. What we are saying is that correct the market to have more nutrition sensitive crops at affordable prices. What is happening right now is that because we don't produce enough nutrition sensitive crops, we are importing these from outside. We are importing pulses from outside. We are importing other nutrition rich legumes from outside. And these are also the main sources of people's micronutrient and macronutrient intake in terms of protein, etc. And because we're importing it, they're not sold at an affordable rate to most of the households. So when households were producing and consuming, when households were more dependent on their own production and not dependent on markets, they were in fact consuming more nutrition-rich food. And this reduction in nutrient in the food has happened parallelly with the structural change in the economy and the structural change in the consumption sources. So instead of saying that we want households to go back to farming, we are saying that make the entire value chain of farming, right from production right down to market, sensitive to nutrition, so that nutrition-rich food are available in the market for people to buy. And there are certain other corrections that will happen at the same time to ensure that even if people are going to the market, what they're consuming at the market is equally nutritionally sensitive. So these corrections will be in terms of course, production is one thing, that you will produce more nutrition sensitive crops so that we don't have to import so much, and they will be available at the market at affordable prices. Second is, of course, we have to work with people's food behavior, food practices, food knowledge, etc., which will also link to the food waste concerns that we have and the transmission loss concerns that we have. We also need to work with value addition in different levels of the food processing, so that even if people are buying processed food, the processed food also is not losing much of nutrition in the entire process. So when we say we want to leverage agriculture for nutrition, we are not imagining that it's the farm households or the households which are doing their own agriculture, only they will be accessing that nutrition. We are imagining that the entire farm to plate value chain will be nutritionally improved so that the market itself has corrected it of the nutrition deficiency. So even if the households, and it's inevitable, households will probably leave their agriculture, go to market. This is a trend. I do not see how, I do not see that it will reverse. And also the focus being on doubling income, etc., I do not see that people will, come back to agriculture and start producing. Maybe in some particular cases it might happen, but as a overall phenomenon, I do not see that happening. But what we are saying is that we need to change the entire value chain towards a higher nutrition output. And there are pilots that have happened in this. Swaminathan Foundation has done a lot of work on this, that there are crops that can be chosen without giving up on the income part. There are crops that can be chosen to have a good agriculture, a good livelihood, as well as nutrition sensitive value output. There are value additions to the crop that can be done so that income remains stable and growing, and yet we have nutrition sensitive crop out in the market. And at the same time, we see that there should be some sort of protectionism for the farmers. So right now also what we are discussing is farmers should have some kind of a basic minimum for the other crops they are growing. So we have been successfully able to protect rice and wheat in India in terms of a guaranteed price, but the similar kind of guarantee I think should also be there for the nutrition sensitive crops, so that farmers are nudged towards producing them. Right now, the indifference towards these crops for these large farmers also comes from the fact that there is no guaranteed market for it. The market is extremely volatile and not profit. So if there is some kind of a guarantee that once you produce the crops, it will not go to waste and will be there will be some protection against it, we may come to a situation where farmers voluntarily take it up, and we can correct the situation of supply at the market itself. So again, to reiterate, I am not just talking about the demand side of it, but also correcting the supply side altogether so that they can work together. Coming to your second question of SDG.
Yeah, sure, please go ahead.
Doubling productivity and yield, whether it's still, so we cannot increase land, that is very sure. And in terms of doubling productivity, again, it has to be responsible. So this yield increase that you see in data, this has happened unfortunately to very aggressive input intensive technologies and very aggressive use of fertilizers, aggressive use of water. What has happened all through North India right now, that we are at a very volatile situation where our groundwater has gone down to a much lower level. Input cost keeps going up, and I don't know how long this will sustain. So now government has shifted and started taking policies to promote crops that are less input intensive. So this doubling of productivity and yield will not happen in these older crops of high input intensity, wheat and rice and higher yield variety. I do not see that happening. It will only happen in crops that are sustainable, crops that take up less, and crops that will have higher impact on both income and nutrition. So this particular productivity yield situation is linked to the nutrition sensitivity of the crops. So we cannot have more and more wheat and rice production. We have to. So now this millet policy has come in. Government is pushing for the crops that are less on the input, less on the water, less on the environment, but have high yield, and trying to kind of secure a market for it. So over time, I'm sure that with the innovations that we have, we'll be able to come to some. But of course, there has to be a multi-layered, multi-level partnership for this. It's not just providing the seeds and the land. It's also about the practices, the agro innovations, teaching the farmers how to use certain innovations or how to use certain practices so that they can have maximum yield even without damaging the environment. So there are multiple partners that have to come in to kind of go to this goal. And your last question on food, cash crops and off farm. I don't think, I think you are referring to the livelihood and calorie intersection graph. Yes, that graph is about the major source of income for the households. Non-farm household means that the household is mainly earning from non-farm sources, and farm means they're mainly earning from farm sources. Cash crops, we have not done a separation. Actually, NSSO data does not, after 2004-5 at least, does not give us the crops that the households are growing. These are two different data sets. So our agriculture data set, our consumption data set are not the same. So food and cash crops we cannot separate, but we can separate farm and non-farm because that household type is given. So from there we see that farm households, which are also at the households that will have access to the production because they have the land, they have the farm. We see these households also go to social protection less, they take more from their own farm. So if they're producing, they are consuming out of it. That behavior has not changed. It's only when the access to land or production is reduced, we see households moving first either to social protection, then last to market if that is not available. So it was mainly a reflection on the behavior of the households, that whether they are consuming and producing at the same time, or whether this shift from consumption to market is uniform across all sorts of households. So I think if crop is available, nutrition is available, the households will consume out of what is available, and this shift to market is not a universal all-around reality for all the households in India.
Okay, we have only 2 to 3 minutes to go, but we will take one last question because BOBP-IGO, they have raised their hand. So can you unmute and ask the question to the speaker? Okay.
Hi, I'm audible. Am I audible?
Yes, you are.
Hi, my name is Sakshi and I'm at BOBP. I really enjoyed your presentation, Dr. Ruchira. So my question is regarding, so a couple of years back, the quality of food that was distributed in the PDS was a concern raised. Is that still a point when, in fact, when regarding nutrition security / food security?
Hurin, can you? It's very slow, so I cannot really hear the.
Can you repeat your question again in a high volume?
Couple of years back, food that was distributed in the public distribution systems was a concern. Is that still a concern when we talk about nutritional security today?
You are
the quality of food.
Quality of food PDS. There have been some concern on the quality. See, these are subsidized food grains, right? So there will be some quality concerns always. But overall, we don't see a decline in demand. In fact, we have seen the highest of the demand of the food grains right now. So people are going to PDS for acquiring these food grains. There may be some regional concerns, and it is a huge system. So there will be imperfections in the system. There will be cases of corruptions, etc. That will always be there. But overall, in the system, I don't see an issue big enough to kind of question the entire system. There may be regional, local issues that may have arisen.
Okay, we are at the end of our time. So we're now it's 12:30. We are going to end our today's webinar. Before ending it, I would like to request all of you just can you open your video so we can take the photographs? Can you all please open your video so we can take the photograph? Thank you. Okay, I'm going to take one first, then another one. Okay, done. Thank you. Thank you so much for joining our webinar series. We will invite you again in our next session. So thank you. Thank you so much. And good day to all of you.
Thank you so much,
Good day. Thank you so
Professor
much.
Bhattacharya.
Thank you so much, sir. Thank you.